Okay, so before I walk into the room, I would knock on the door just to make my presence known. When I walk into the room, I would wash my hands and introduce myself. Hi, my name is Abby. I'm going to be your student nurse today. Um, just to verify doctor's orders, we are placing a Foley catheter today. Can I get your name and date of birth? And then they would tell me their name and date of birth. I would check it against their wristband. I would ask them if they are having any pain, if they have any allergies to shellfish, iodine, anything like that. They would tell me no. I would have the curtain pulled just so the patient has more privacy. I would raise the bed so I don't have to lean over. I would have all my supplies set up here. Before I do my procedure, I would explain to the patient, she's going to be exposed. If she has any questions, I would explain the procedure. There might be a little bit of discomfort, some pressure whenever I'm inserting in the Foley. I would first, drape. She would be in the lithotomy position, so her knees will be up and away from her body so I can see the area. I would have the bed raised, go ahead and take the guardrail down. I would place a blanket over the patient to give her a little bit more comfort and privacy. Before I would wash my hands and open up my kit. I would use my bag and place this at the side of the bed or the foot of the bed within reach, so I can toss away my betadine and everything like that. I would peel away. So right now I would have just normal gloves on, preparing the patient. First, I would make my sterile field. So I would pull it away, to the side, to one side, and then towards me. I can touch the 1-inch borders just to maneuver it around. With this, I would take my drape. Usually I would have a drape out already because this is all sterile. But I would take this drape with the glossy side down and just place that between the patient's legs so I don't get betadine or any urine on the bed linen. I would also go ahead and take off my regular gloves and then put on my sterile gloves. My glove ripped, but if that were to happen in a patient situation, I would just go ahead and take them off and get a new pair of sterile gloves. So now my hands are sterile. This is all sterile. I can go ahead and touch my sterile field. I discard that in my bag. So I have my sterile drape that I would expose over the perineal area. So before I even insert or wipe with betadine, I would just check the area to make sure that there's no lesions, any redness. I check for bladder distension, everything like that. And in her case, she is fine. So I can go ahead and get everything set up here. I can still keep this on my sterile field. So I have a specimen cup just in case the doctor needs anything like that. So I'm just to keep this, just so if I need to reuse it, I would put my iodine on my swabs. Since this is empty, I'll go ahead and toss that. So, and then I'll go ahead and get my lubricant ready. So go ahead and squirt that into the little well that's in the container. Then I can toss that. So, got my betadine swab. With my non-dominant hand, I would open swab top to bottom, and then I can toss that. Get another swab top to bottom in my bag. And last one, clean top to bottom. Now I can go ahead and get my lubricant, or my saline attached I'm going to move this over between the patient's legs. This will have my paper on there. So with my dominant hand, I'm going to remove the paper or the plastic. Still not touching with my non-dominant hand. So I would go ahead and get my tip of my catheter lubed up, and then I would spread the labia with my non-dominant hand. I would go ahead and insert, and keep inserting. And then you would go ahead and keep inserting until you get a flash of urine in your tube. And then I would advance maybe a ½ inch further. Then I would go ahead and with my dominant hand, put the fluid and blow up the balloon. My straw is a little bit too small for the tube to advance, but I would fill it up to extend my balloon. And then after my balloon is full, I will go ahead and pull on it a little bit just to see that it's in place. After it's in place, I would go ahead, take off my gloves. I can toss those in the trash. Wash my hands. I put on a new set of gloves, just regular gloves. And then I would tape this to the patient's leg and then let it hang off the bed, clip it to the side of the bed so it goes against gravity and can drain down into the well. With removing the catheter, I can go ahead, I would wash my hands, just tell the patient that just take a big deep breath whenever I'm pulling it out. Whenever I would insert the catheter, I would tell the patient to bear down, and she would have some pressure. And as I advance, the pressure should get a little better. So I would have a new pair of gloves on whenever I'm removing the catheter. I would go ahead and reattach my syringe and suck up the saline that was in the balloon. I would go ahead and with my non-dominant hand just spread the labia and then pull and kink and then wrap it up in all of my towels just so it doesn't drip on the patient, and then throw it away in the trash can. And after I'm done, I would ask her if she's having any pain, any discomfort. Just ask her if she has any questions about anything. I would go ahead and after removing the catheter, I would go ahead and cover her area just so she doesn't feel exposed. And then put the bed back to her normal height for her. All the way down to the ground in case she needs to get out. Have 2 guardrails up just in case if she has that kind of restrictions, and have her next to the call light in case she needs anything. After my assessment is done, I would wash my hands and thank the patient and then step out of the room.